In this presentation we will discuss about Newcastel disease. Newcastel disease is an infection of domestic poultry and other bird species with virulent Newcastel disease virus (NDV). It is a worldwide problem that presents primarily as depression, nervous manifestations, or diarrhea may be the predominant clinical form. Etiology. Newcastel disease (ND) is a member of the family Paramyxoviridae in the genus Evulovirus. There are 10 serotypes of avian paramyxoviruses designated APMVI to APMV10, and ND virus (NDV) has been designated APMV1. NDV has also been categorized into 5 pathotypes based on clinical signs in infected chickens, designated viscerotropic velogenic, neurotropic velogenic, mesogenic, lentogenic or respiratory asymptomatic. Pathotype groupings are rarely clear-cut. The original classification of NDV isolates into one of 3 virulence groups by chicken embryo and chicken inoculation as virulent velogenic, moderately virulent mesogenic, or of low virulence lentogenic, has been abbreviated for regulatory purposes. Velogens and mesogens are now classified as virulent Newcastel disease virus (VNDV), the cause of Newcastel disease and reportable infection, whereas infections with lentogens, the low-virulence Newcastel disease virus LONDV, widely used as live vaccines, are not reportable. Epidemiology and transmission. Virulent Newcastel disease virus NDV strains are endemic in poultry in most of Asia, Africa, and some countries of North and South America. Other countries, including the USA and Canada, are free of those strains in poultry and maintain that status with import restrictions and eradication by destroying infected poultry. Cormorants, pigeons, and imported cetacine species are more commonly infected with VNDV and have also been sources of VNDV infections of poultry. NDV strains of low virulence are prevalent in poultry and wild birds, especially waterfowl. Infection of domestic poultry with LONDV contributes to lower productivity. Infected birds shed virus in exhaled air, respiratory discharges, and feces. Virus is shed during incubation, during the clinical stage, and for a varying but limited period during convalescence. Virus may also be present in eggs laid during clinical disease and in all parts of the carcass during acute VNDV infections. Chickens are readily infected by aerosols and by ingesting contaminated water or food. Infected chickens and other domestic and wild birds may be sources of NDV. Movement of infected birds and transfer of virus, especially in infective feces, by the movement of people and contaminated equipment or litter are the main methods of virus spread between poultry flocks. Clinical sign. Onset is rapid, and signs appear throughout the flock within 2 to 12 days, average 5, after aerosol exposure. Spread is slower if the fecal-oral route is the primary means of transmission, particularly for caged birds. Young birds are the most susceptible. Observed signs depend on whether the infecting virus has a predilection for respiratory, digestive, or nervous systems. Respiratory signs of gasping, coughing, sneezing, and rales predominate in infections with low NDV. Nervous